Everyone, welcome to a very special edition of In the Weeds with Jimmy Young. Today we are joined by my good friend Alissa Merrill, the CEO of flowerandtonic.com. She is our cannabinoid medicine expert, if you will. And speaking of cannabinoid medicine experts, we're also very happy to be joined by Mara Gordon, coming in from California. So Mara, first of all, thank you so much for coming in and talking with us today.
It's my pleasure. Thank you so much for inviting me.
And as I mentioned to you in our little remarks before, I actually watched the Weed the People movie for the third time today. Happy to find it on YouTube and available, because the first time I was able to see it, it was part of a Education Foundation special showing. That was a couple years ago, I believe, when it first came out. Can you give a little bit of a background on exactly how that movie came about and how you got involved with it? Because I believe it was like a 5 or 6 year endeavor, correct?
Yes, it was quite a commitment. Initially, back, I would say it was like 2012, 2013, I had been asked to participate in a lot of documentaries. And there are several out there that have little snippets and pieces of me here and there. But I never was willing to really jump in and be part of one, because I felt like all of the teams that had approached me already had decided what the conclusion was going to be. And they were just looking for people to participate in it to prove their point. Like, in other words, cannabis should be legal for everybody in the world at all times. So we're going to push that thing, and we're going to bring a bunch of people in, and we're going to create this dialogue. Well, that to me is not a documentary. That's a commercial. So that didn't appeal to me. When Ricki Lake, the talk show host, when her movie star and everything else, when her late husband, Christian Evans, approached me about participating in this documentary that they were starting, I, of course, was saying no, no, no. And he's like, just at least come and meet Ricki and see what, and let us talk to you. And initially, it was a little girl that had heard Ricki or become a uber fan of Ricki when she was on Dancing with the Stars. And this little girl had a very rare medical condition that was not being well addressed by traditional medicine. And they had talked about using cannabis. And so they were looking for a cannabis, somebody who was expert in making medicine and dosing and all these things. And that led them to me. Very quickly, the little girl's mom got snake bit and decided not to do it, moved out of state with the little girl. And so we had already been filming. We already had this stuff in the can. And then interestingly, I was actually in St. Louis, Missouri, sitting Shiva for my sister who died of cancer, when I got a emergency text message from Abby Epstein, who was the producer, the director of the film, saying, there's this 8-month-old baby with cancer. We need your help. You need to come help her. So I approached my family and I said, we're always about the living and not the dead. And so how do you guys feel about me leaving early during Shiva to go and take care of this baby? And they're like, are you crazy? Of course you're going to go take care of this baby. So that's what I did. I left St. Louis and I flew back to to California, and I went down to LA. And you see in the film, the first time that we actually meet in person, I bring her the medicine to start, I give her the baby medicine. So that's how it all started.
And how many do you think you've saved, Mara, over the last few years or so, which is an amazing thing to be doing God's work like that?
I don't know that I saved anybody. I think the medicine is pretty powerful. We have treated over 10,000 patients, and a lot of them, a significant amount of them, cancer. And I can say that based upon our data, the longevity and the quality of life of many, many of these people is far improved by using our medicine and our dosing protocols. would it have been just as good on something else? I have no idea. But when somebody normally lives 22 months after a diagnosis and they're talking to me 7, 8, 9 years later and they're still alive, I feel pretty good about that.
You absolutely should. I'm sure the word angel has been thrown out there a few times, and I think you qualify for sure. Alissa?
Well, certainly in modesty, because I've had the pleasure of meeting Mara a little over a year ago at a cannabinoid conference where she was one of the keynote speakers, and that conference just opened my eyes to the farm, truly that what I always believed, that this was medicine and pharmaceutical level medicine. But modesty is certainly part of who you are, Mara, because I didn't even know after all this time knowing you, 10,000 patients, that was news to me. That's amazing. So, and can you share a little bit about, collecting the data and how I feel like you really were one of the only people attempting to go there and get the research and make it an actual potential pharmaceutical product.
Right. Well, I appreciate your kind words, Alissa, a lot. I'm a huge fan of yours.
We all are.
Well, why not? I mean, she's amazing.
Yes.
So one of the things that I think that I bring to this, just to address the modesty thing for a minute, it's very important to me that everything about my organizations, and even though using the word everything is contraindicated, is we like to say that we're hyperbole free. And by remaining hyperbole free, I don't buy my own press. There've been a lot of things written about me and a lot of things that I was in a thing the other day and a guy holds up, it was a Zoom meeting and there's like 25 people on there, and he holds up to get my attention, and he holds up a piece of paper and he's written hero on it, and it's like, you're only as good until the next thing that comes out that destroys everything. You never know, you never know. And I've been I had a single focus. I've kept that focus all these years. And I think that's gotten to me where I am. I haven't been distracted by every shiny object out there. So when I first came to cannabis and was utilizing it or trying to utilize it to deal with mine and my own husband's health conditions and issues, what really astounded me was the lack of transparency and data and understanding around what the products were and how we were supposed to use them. Now, I'm a process engineer by training. And so I look at this and I'm like, okay, you're giving me, and I've told this story a million times, a lot of times, you have like a Rice Krispies treat wrapped in cellophane that somebody obviously made in their home kitchen. It's got masking tape across it and it has in a Sharpie 5 to 20. And that's the only thing that's on the thing. And you're telling me, young bud tender you, that this is medicine, and how am I supposed to take it, and how do I know? And why would you give me junk food to take before bed with sugar? I mean, it's like nothing about it made sense. So I said, you know what? I'm going to figure out this dosing thing. I'm going to figure it out. I'm going to figure out how to treat different diseases and how to know how much to take and how to do it consistently, because I have no interest in cannabis becoming my lifestyle. I'm not burning my bra and wearing tie-dye and getting dreads or all the stereotypes that I brought to this a decade ago. Of course, obviously I've evolved, or I hope I've evolved since then in my understanding and acceptance. But that was where I was. And it was like, I just want to take my medicine and go about my life. And I realized I am so representative of the vast majority of people. Everyone that was using cannabis at that point was an early adopter. Right. They were people that they were outside the norm. So I couldn't focus on the norm. I had to focus on what was the need. And the need was well understood, lab tested, accurately dosed medicines with profiles to treat different diseases. So that's where I put all my focus. And that's what I've been doing. I mean, I've had more people come to me. It's crazy with, oh, you should come out with this, and you need a vape pen, and you need whatever. And the whole idea of Aunt Zelda's was all about making medicine that I understood, so that when we were treating patients, the data we got back about it was empirical data. And that's we've done that now for a decade.
I remember in the movie you were actually taking handwritten notes, and that's so old school, and it's something I also respect quite a bit, because I still do my chicken scratch notes too. But as an engineer, you know, if I remember, you come from the University of Texas system, am I right?
I'm from University of North Texas, but yeah, Texas system, yeah, same.
So, you know, you learned a little bit about software engineering, I'm guessing, at some point, and now you've incorporated that, and actually keeping track of dosing and consumption is what a lot of educators talk about now when they start working with people. Don't just take any old strain, do some research, find out what the strain is about and what perhaps impact it might have on your body, even though I think everybody knows every body is different. So the challenges that you faced, especially in the beginning where you were pioneering this titration and dosing, to me is amazing, and I'm guessing you took meticulous notes too, didn't you?
But I mean, I have every one of my lab books. I was using composition books, you know, the old style with the black and white blotchy on the front. And the reason for that is because the pages are sewn so that you don't have to worry about a page falling out. So I've been using those throughout my entire career, even when I was in, you know, my background was in technology and, you know, very complex systems, especially when I specialized bringing together legacy systems and making things that don't match. And that's kind of what cannabis is, if you think about it in a lot of ways. But yes, taking meticulous notes. And then eventually, I think it was like 2014, something like that, actually built our software platform that doctors have been using and nurses have been using to not only be able to make a correct dosing recommendation to a patient by seeing what all has worked in those areas. For example, patient comes to a doctor and says, I have ER/PR positive breast cancer, I'm stage 3, and I'm 52 years old. What should I use? Well, the physician can go through the data around who we've treated in the 50 to 55 or, you know, 45 to 50, whatever they want to do. They can pick that range of patients, see the de-identified data, and find out where to start. It's like you said, it's all different and everybody's different. But I had a cardiac procedure 2 weeks ago today that was not successful. And so the doctor wants to start me on a pharmaceutical. And I researched it. I talked to our doctors to make sure that they're okay with me starting on it. And I could have taken verbatim what this cardiologist was saying to me and apply it to cannabis. He's like, you have to be patient with me. It's going to take a while to figure out the right dose. This might not be the right drug. And I'm like, why is that acceptable in pharmaceuticals, but not acceptable in cannabinoids? Mm-hmm. It's the identical discussion. So it's us normalizing cannabis to be is accepted and non-demonized by making it where doctors feel comfortable because they have data. So yeah, I've taken copious notes, and all those scribbles that were in my books have all gone into the system. Yeah.
I wish I had someone to do that with my notes, but I was on my way here. I drove by the New England School for Autism, and you know, that's what I think really, you know, excites me to know that there have been, I used to sell Ritalin, and that was really the only alternative for kids were stimulants. So, you know, what is the most, obviously that's an area you focused on. Can you just talk to me a little bit more about, there really hasn't been a treatment option. I'd love to hear more about what you've created and how patients respond differently, what you're seeing clinically in some of those patients.
And you're talking about autism.
Yeah.
I don't really feel that I'm as qualified to answer all of that. I can talk to it from a corporate-y kind of discussion and some of the science. What happened was we did an observational trial at CHOPS in Philadelphia, Children's Hospital of Philadelphia, on autism. And at the same time, we began conversations with Alira Healthcare and the Hope product that they were developing. And we thought, we have all this expertise over here in trialing and all this stuff. Let's go ahead and bring them together. And we ended up merging and becoming Zelira Therapeutics instead of Zelda Therapeutics. All of this separate from Aunt Zelda's, but Zelda Therapeutics and Alira Healthcare. So the autism, I mean, I could talk a little bit about the fact that we didn't really have anybody that it didn't work for. There were negligent or negligible negative side effects or anything like that. And it worked. We already know it works. And that's the beautiful thing about cannabis is we are able to now trial things that people have been using on their own for years and years and years. Well, thing we did find out though, is you got to have THC. You absolutely have got to have THC. I think that and this is maybe a separate entire conversation, but the travesty of the CBD hemp industry is criminal. And I think we're going to look back at this historically at the way that they are hurting patients with this model. It's disgusting to me. And the only one that wins are the corporate bottom line. The patients certainly don't win. And I think with autism in particular and seizure disorders, which often, by the way, a lot of people with autism also have seizure disorders. You cannot just put them on CBD in most cases without THC and have it be effective. So it's got to have the whole plant profile in there.
Okay. You had something to follow, didn't you? I have one if you don't.
Yes, no, please go ahead.
Okay, so I'm guessing that as your reputation was building, you were getting more and more accepted by the medical community, or were you always trying to prove yourself to the medical community?
I've tried the best I can to keep myself out of it from the standpoint that the science speaks for itself. Because I've joked around many times and I've said, I'm not a doctor and I don't even play one on TV. I'm not a doctor. Everything I'm doing is about empowering doctors to take better care of their patients, right? So by approaching it that way, I think a lot of people that I've witnessed in the cannabis space over this last decade, I've often heard, and then there's one line in We the People that I cringe at when I hear, and that is that we can't practice medicine. That's not we don't have the education, we don't have the credentials, and it's wrong, it's immoral, and it's illegal, right? But we can do no harm by giving people what the data is showing is working and how it's working, but educate doctors. I've had more doctors come to me over the years begging to work with me, begging me to have access to the data, show me how you do it, teach me what you do. And that's one of the reasons that I have been getting on airplanes all the years, is to teach doctors. That's why I was at the conference where I met with Alissa, was because they're getting the wrong messaging and they need to hear what's actually working from the ground level and from studies. But there are a tremendous number of doctors that resent me. And you know what? That's about them. That's not about me. So right. I'm just going to keep on doing what I do. And some will love me, some will hate me, and I'll focus on the ones that love me.
Is that a Western medicine versus Eastern medicine kind of battle that is always ongoing in the medical community? Because I certainly recognize the strengths of the plant diet that's out there now, the vegan that are out there, and I see the benefits to that. And I'm starting to see more and more respect for plant medicine, and cannabis is the biggest part of that.
I think that the way that medical education has been taught over the last 80, 100 years has done a terrible disservice to doctors themselves and their education. And then as a result, what patients have been then left having to deal with as a result. Doctors used to have to be much more active in their treatment of patients, and it's become very mechanical from the standpoint that you have this disease, you give them this medicine, you give them this dose, it doesn't work, you then give them that one. If that doesn't work, then you give them that one. We have all the subspecialization in medicine that has been, it's ridiculous, where doctors are forgetting how to actually practice medicine, how to listen and do a diagnostic. I do believe that COVID and going to virtual is going to force doctors to actually dialogue with their patients in a way to ask them the right kind of questions, to get the right kind of information, to make better recommendations. But the medical community is used to this single molecule as if it's the way and the path and the light. And the reality is it's a blip in medicine. It's a blip. It's less than, it's 100-year blip compared to thousands of years of treating patients, utilizing whole plant, utilizing other sorts of breathing, the breath therapy. Reading, if you ever read the book Breath, I mean, it's phenomenal on how many different things and what happens at a cellular level. Medical, I mean, you have 10 minutes in an exam room, you boom, 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 you got to get them that pharmaceutical, you got to get that off to the pharmacy before you leave the room or never gets to get done. That's Western medicine. And that's what we've co-signed because of big pharma and the insurance industry. Get them in, get them out, get them treated, boom, done. And that's not the approach to Ayurvedic or Eastern medicine or in other forms.
I always use the example, I have an amazing mom, and she would do anything for me, and she did not breastfeed. And she said that I was born in 74, and she said that you only breastfed if you couldn't afford formula. And today, I mean, that is certainly not the case. So I am hopeful that with the science, I feel like I know, actually, I can say that doctors at major hospitals, like the information as you're presenting it, it's credible and it's enough to offer patients confidently a safe alternative. So I really do see things shifting. I hope I'm not crazy, but yeah, to formula now is, a little, it's just amazing how much opinions can change, and I think you're doing a great job changing them. Thanks.
Thank you. To your point, Alissa, I like to say that when we know better, we do better. Mm-hmm. And there's no malice in the way the doctors are doing it now. They just don't know any better because that's what they're taught. Yep. And so it's up to us to give them a safe space to expand their practices and expand how they do things in a safety zone where they're not going to risk. How many times have I heard people say, I'm not going to risk my license. I'm not going to risk my license. It's all about maintaining the ability to continue doing what they're doing. And so we just have to make it where it's safe enough for them to do that. If you look at plant medicine, I read something today, and it actually was the very first time that I had read this statement that I didn't necessarily believe it. And it said, nobody has ever died from an overdose of cannabis. And that's true. That is true when you think about the cannabis plant. But what's happening with all these isolates and these single molecule drugs that are coming out of cannabis, maybe they won't overdose, but is there going to be a lethal dose? We don't know. We just don't know what happens. One of the reasons that you can't die of cannabis, obviously, is because you don't have CB1 and CB2 receptors in the brainstem, and so it doesn't repress your oxygenation and your respiratory system. But the reason people didn't die of opioid opioid overdose, in the past was you couldn't eat enough poppy plants. You'd get sick and puke your guts out before you ate enough to kill you. Cannabis, you can't smoke enough, eat enough, any of that in its whole form. We have no idea what's going to happen when people start making pharmaceuticals out of cannabis with a single molecule. to start using indiscriminately all over the place. And like I've talked about many times, Merrill, for example, we already have it. One and done. We have it. We have single molecule THC. Don't need to do any more single molecule THC. People can't stand the way it makes them feel. It's better than other drugs, but it's not very good. And if it was really great, there would be a street market and you could buy Merrill on every street corner. Right? So we have to get doctors to understand putting the good of the patient needs to come before the ease of prescribing.
One of the things that has been a theme, not only in our conversation here, something Alissa actually mentioned as well, is, and in the movie, women and mothers specifically tend to be the best advocates for their children. And I'm seeing the impact of the woman in the emerging cannabis industry as well. I'm always seeing the stories of the mother who advocates for that child. That's an inbred role that the mother plays that, you know, men can never have that. I can promise you that they will never be able to bear children. And I just think that bond, how it's transferred over to the advocacy, not just for their children, but for this plant too, to be accepted as a medicine. I'm sure you found this to be true over the last dozen years or so in your journeys.
I agree. And in fact, I'd suggest you watch the documentary, Mary Jane's Women of Weed.
Yep.
It was out by Wendy Borman. It's a good one. And she addressed, you know, she went looking for one thing and found a whole different set of answers over here. But, you know, women make over 80% of the healthcare decisions in the family.
Right.
Always have, always will. Well, I don't know about always, but they certainly have for an awfully long time. That's the way the Western and Eastern, I mean, I've talked to people to help them with their family members as far as way of Siberia, you know, and China and all. I mean, it's like, this is a universal sort of statement that 80% is me. So, and one of the interesting things I have found is that women will be warriors for their family, but not warriors for themselves. So getting women to comply with their protocols is so much more complicated than it is to get them. If I tell them you have to wake up at 2 o'clock in the morning and you have to stand on your left foot up in the air and you have to spin around and give your kid this medicine and it's going to save them, that mother is going to set her alarm and she's going to be up there and she's going to do it. If I say you have to do this for you, well, I have to get up early. It's, you know, I got to get the kids to school. I got to, you know, it's like every excuse in the world. I think what's happening with women in the cannabis space, one of the things that I find really disappointing is when I came into this space, there were so many women that were making amazing, beautiful tinctures and topicals and all sorts of interesting products to help the people that they were helping in their like little collectives. As soon as it became more profitable and you started bringing money into the space, the money started going to the men, or the women were kicked to the side. They have a much more difficult time raising money. The focus goes to shareholder instead of to the patient. When women are driving it, and this is a huge stereotype, but you know, stereotypes are usually based in fact to a certain extent, right? Let's face it. So most women or the women that I've seen in this space that were in this a long time ago, it was about helping people. And that doesn't fly when you're trying to raise money. They want to know what's your exit strategy, what's going to be your ROI, what are your margins. And so we need to help these women to have the support around them so that they can continue to focus on creating things to help patients. And that's just not the way the business is designed today. A lot of time they want the woman's name on their board or on their masthead, but they don't give them any actual support. When I
Yes.
first started, there was, I think women were 32 or 33% of the industry, and now it's down in the low 20s.
Wow.
Yeah.
And is that because the men are still controlling the capital markets?
Absolutely.
Aha. All right. I do want to get back to something you mentioned. You were pretty adamant about it too. The situation with hemp in this country and this whole CBD thing. And needless to say, when Mitch McConnell signed that farm bill in 2018, he had no idea what kind of a Pandora's box he was opening. They never did.
Yes, he did. Oh, yes, he
Oh,
did.
tell me why. Tell me why.
Oh, yes, he did. Look at his family. Look at what his family owns.
Aha. Gotcha.
Yes.
So he knew So he knew that he was putting money in his family, but he didn't realize the big industry that he was kind of giving not legitimacy to, but an opportunity to expand without ever really researching the impact or how the regulations were going to work. And now you've got a federal government that's in totally dysfunctional. And yeah, I don't see anything getting done in the next few weeks, let alone next few months. With the DEA pointing fingers at the FDA and the USADA, that would be the agriculture group. No one wants to take responsibility for it or regulate it. Are we ever going to see what we hope to see as far as regulations go and testing and dosing and anything like that as far as hemp and CBD goes?
Well, I'm an internal optimist. So I hope that right now we're just experiencing the pendulum effect, and that eventually everything's going to normalize and saner heads will prevail. At least that's my hope. I am such a huge proponent of hemp. I think hemp could save this planet in many ways, 100%. They have no business growing it for CBD. It should be grown for industrial purposes. It should be grown to replace oils and plastics and fibers and concrete and on and on and on and on, and the different various uses for hemp. It's crazy how, it reminds me of manna in the old, it's like, it is whatever you need it to be. The 0.3 or 0.03 or whatever the number is of the threshold for THC in it, that was some number that two guys in Canada came up with, and it got adopted. It has zero scientific basis to it. Zero. And it has caused this boom in this thing saying, oh, if there's no THC, then it's okay. And what I've been saying all along is, well, the Marijuana Tax Act, and if you look at all that, it doesn't say THC, it says marijuana. So you're playing a game with this to wink, wink, push your own industry so that you can go across state lines and not have all the limitations that we have in the cannabis space. But they're not real. They're not real differences. They're fake. They're manufactured for the purposes of getting around a law you don't like. And they're certainly not for the benefit of patients. I just think it's disgusting. I had a woman call me the other day. Excuse me. She reached out to me on Twitter. And I'm like, okay, here's my email address. Send me the information about your 9-year-old daughter, right? With this rare cancer. And she said, she says, well, she's taking this CBD product, and I don't know what she should take, how much of it and everything. I said, she's trying to explain it to me. And I said, just take a picture of the labels, so I can read it and send it to me and I'll look at it. I was so angry when I saw the picture of what they had sold her. It was, did I already tell you this, Alissa? I don't remember.
Me. Yeah,
you told
us.
I
was so angry. Yeah. It was a CBD vape pen refill that they had sold this mother to treat her 9-year-old child with stage 4 cancer.
Ugh.
Something There's no, I mean, how do you live with yourself? Where's tikkun olam? Where is saving the world? Where is making the world better because you were here, not just let me screw around everybody and hope they don't catch me. And that's what I feel like the hemp industry is. Now, granted, there are places in the United States, places in the world that it's the only thing that's allowed is under the ridiculous threshold of THC. But the types of products and the lack of oversight and it's just, to me, it's criminal. It's criminal because at the end of the day, it's human beings. Anything you put in or on your body should be safe and to a level that it's appropriate for you. And some of the stuff that's being made out there does not meet those thresholds.
I would say potentially dangerous,
Extreme.
actually dangerous to many patients, and to the point where, yes, I couldn't agree with you more. It's kind of a shame, but I think it's hopefully I think we're on the verge of trying to make some improvements in the industry.
A change would be beneficial to many in so many avenues right now. Can you look into your crystal ball and see where we're going to be as far as a country, as far as legalization, as far as acceptance in 4 to 8 years?
I wish I could. I think that on one hand, the push for legalization is a little bit frightening, because if you don't have a structure in place for when that happens, you're going to have the same chaos that you have in the hemp space with cannabis. And who's going to be around to pick it up? Big pharma, big alcohol. I mean, totally going to miss the boat. So I think that we need to have our foundation in place before that happens. In California, everybody was rushing to, legalize adult use. Prop 64 passed here. And I was like, oh my God, this is going to be the beginning of the end. And it's precisely what has happened, is all this rush to the small market, big money, dominating the fields by people who have no understanding of what they're actually working with and who the end consumer needs to be. And if we do this at a federal level, I mean, come on. Do you really want this to be like, oh, now it's legal and it's a land race, whoever can get there first to dominate? I don't want to see that, because I think that cannabis has tremendous benefit and potential, but it also has tremendous risks if not addressed correctly. Nobody even talks about, or I shouldn't say nobody, rarely do you hear about the interactions with the cytochrome P450 and the interactions with other pharmaceuticals, and how, potential dangers and liver damage, especially with CBD, way more so than THC. You have liver enzymes going through the roof on certain patients because they're taking CBD at the same time they're taking their drugs. Wow. So, I hope that it's not legalized until we have a system in place to support it. Can we do that in 4 to 8 years? Absolutely, if we had the right administration with the right ethos. But regardless of what happens in a month in the election, we're still not going to have it. We're still not going to have it.
A piece of news today from California. I read that some California banks are now going to be able to actually do business in and with the cannabis industry. Now, obviously, we're still with a federal illegal substance. The federal government could come in and screw things up. But is that you're in California. You just talked about Prop 64. Is this a good thing? I think anytime you can actually do banking and you don't have to do it with cash, it's an improvement, but it's not the where-all and end-all. Is that accurate?
Well, just to kind of add another little thing is, I'm on the board of directors, and I'm a director of North Bay Credit Union. And we've been giving money, or we've been working with cannabis. We've been doing this for almost 3 years now, that we've been banking cannabis businesses. And they brought me in on that board because they wanted to have somebody who understood cannabis and understood how to look at a business and see if they were full of crap or what they said actually was legitimate, right? Because they didn't even know enough to know what they didn't know at the time. Right. So we've taken so much money off the streets already. And so we've already been banking in California for quite a long time. It's just for it to be getting where the governor is supporting it and things like that, it's another story. Anybody that has federal oversight or gets money back and forth, like the FDIC and things like that, they're going to have to be careful how they do that, because they can get shut down and have, I personally am liable the same way that the other officers in the bank are. We're liable for suspicious activity if we recognize it and we don't do anything about it, right? So there's it's not for the weak of heart to take on banking. I'll tell you that, not at all. But I think it's going to encourage different types of investors, knowing that banking is possible. It also increases this caliber of employee that you can attract, because they know they're going to be able to put their paycheck in the bank and maybe get a car loan and be honest and authentic and live in the light instead of living in the dark and hiding who they are and what they do. It legitimizes us and elevates us as a legitimate business when we can actually bank. So I think it's a huge step in the right direction.
There you go. And just for the record, we are in a credit union in Rhode Island after a bad experience with the bank. So we support that. Hey, tell us a little bit about Auntie Zelda's and how it's going and how people can find it and all that neat stuff.
So it's Aunt Zelda's. Aunt Zelda's is, it's interesting. I'm in California right now, and I think December, January, we'll be in South Africa and in Brazil. So I'm very excited about that. I wanted to find a place in the world where I could manufacture for export at a GMP facility. And I met these guys a few years ago, and they came and sought me out for my data initially. And then we started talking, and they were building a much bigger operation. And we realized that we were completely like-minded and decided to do this thing together. So they're licensing, it's all of our SOPs, our IP and everything that for how they're going to be manufacturing, with the selected cultivar profiles as well. In California, the way that we've been right now, because I haven't really been interested in being any dispensaries, because dispensaries don't match what I do. Work with the patient, our doctors, think about it. Can you imagine? I'm going to give you the scenario. You go to the doctor writes a prescription for you. You go to CVS to pick it up. And when you get there, the kid at the counter goes, nah, I don't think you should take that. I think you should go and take these chewable aspirin. Well, that's the cannabis industry right there, right? So I haven't been interested in that. What I have done is I've worked with key delivery services that do fulfillment for us. And which works differently, because there's no advice from the bud tender. There's the entire transaction. We just tell them to go, this is what you're going to get and whatever. So this has also been problematic. So I've rebuilt our software platform, and Alissa, I believe, will be bringing it to Massachusetts, the doctors there. And what we're doing is we're vetting various products in each category. For example, a transdermal patch, a set of raw cannabinoid products, the ones like mine that are the high THC and high CBD, but all from cannabis, not full spectrum, real full spectrum, not this not marketing full spectrum, topicals. I mean, you name it. All these products, we vet them through their COAs, where we're able to see whether they're good or not. So when a doctor makes a recommendation now to a patient, I want you to use 5 milligrams of CBD, or excuse me, of THC, and I want you to use 50 milligrams of CBD, and I want you to take this in the morning, and I want you to do sublingual and all that, the way that our doctors, and I want it to have beta caryophyllene in there, and I want it to have limonene. These are the way our doctors recommend. When the patient receives the recommendation from the doctor and they look to see which products that are available or in their area, it'll only show them the products that match what the physician wants them to use. So no more bait and switch, right? It'll only show them, okay, if the doctor wants you to use a sublingual, it'll show you a sublingual that has the profile. And then once you select, it'll then give you the instructions specifically how to titrate and take it to match what the doctor wants you to use. And so we're basically automating what we've already been doing internally. So Aunt Zelda's was an R&D company, never designed to be scaled in its present form. It was always about getting the data, matching it to the products to see what was working for different diseases. Now we're ready to start making it available now that we can support it the way we're going to in our platform.
Well, that sounds exciting.
Very exciting. I've been working with some key delivery services here to do fulfillment, and it'll be set up on a recurring subscription model. Like I get a text every 75 days from CVS asking me if I want to refill my medicine. I say yes, it sends it out to me. I say no, it asks me when I want to get a reminder. We're going to be doing the same thing because cannabis should be no more complicated than taking any other medicine.
Wow, that's a great way to wrap things up, I think. Mara Gordon, you were just terrific. I can see why Alissa has so much respect for you, and I know she's excited about having your products on Flower and Tonic too.